Hello, my name's Peter Ross, and I'm Associate Lecturer and Researcher within the Department of Management at Birkbeck, and also a visiting lecturer at the Southwestern University of Finance and Economics in China. And I have a particular interest actually in healthcare management research. And I like very much to undertake applied research. And I really enjoy working on collaborative projects with clinicians and managers from the NHS, as well as from the independent sector and charities. And so my research revolves around issues really of quality improvement and worker engagement and performance, and also innovation adoption. And I like generally to adopt a mixed methods approach to my research so that I can explore and explain the phenomena of interest. This is quite commonplace in healthcare research, of course. For example, undertake projects to measure variation in clinical performance, doctors' performance, and maybe to identify factors that influence adoption of a process innovation, and designing and developing national NHS patient experience survey questions. Currently, I'm collaborating on a project with Prostate Cancer UK to map variation in cancer treatments for patients in order to better understand the reasons for the variation in treatments. Thank you. The paper I'm going to briefly talk about here then represents a collaboration really between NHS England, University College London, and myself, and also Marion Friends at Birkbeck. The paper is essentially about quality management and maintenance of PET-CT services across England during the first wave of the COVID-19 pandemic. And for those of you unfamiliar, PET-CT is short for positron emission tomography, computer tomography, and it's a key piece of medical technology. It's a key diagnostic imaging test in the investigation of people with cancer. So it acts a bit as a proxy indicator of cancer, if you like, across England. The purpose of the paper was essentially to empirically measure the impact of the first wave of the COVID pandemic on this important piece of cancer imaging on PET-CT scanning activity across England. And I guess secondly, also to assess, importantly, the ability of NHS England to continue to meet patient demand in a timely manner. The idea for the paper actually came out of a meeting with senior NHS managers, which I was attending as an invited attendee. And basically the problem was that back at the peak of the first wave of the COVID-19 pandemic last year, there was really very limited data to provide NHS managers with an accurate and detailed overview of the impact of the pandemic on this important diagnostic cancer service, imaging service. And also back then, managers really and clinicians were very unsure as to whether any fall off in the ability to scan and fall off in scanning activity was due to the inability of NHS England to deliver the services with all of the demands that was incumbent on them to maintain social distancing and that, as opposed to the lack of activity being due to a lack of demand. And so to address this important research question, we set up a project to collect scan cancer scan activity, if you like, PET-CT scan activity from all over England, from 41 NHS England scanning centres across England during the period June 2019 to June 2020, so that we could compare before COVID, after COVID. And this data that we compiled and collected represented actually 90% of all the scanning activity within England. So it was quite a large and unique data set that we compiled. And the data was compiled in a database in Excel and analyzed using Stata software to assess the distribution and statistical significance of the variation in monthly scanning activity. And then the imaging volumes were aggregated, and descriptive and inferential statistics were applied so that the impact of the pandemic on scanning activity could be evaluated. I guess the results of the paper, the findings of the study, showed, firstly, importantly, that there was a 32% decrease in the number of people having PET-CT scans at the peak of the first wave of the COVID-19 pandemic in April 2020. So a really large drop in activity. But interestingly, there was no decrease in the scanning turnaround times. In other words, the speed and ability of NHS to scan patients. And there was no correlation found in our data sets between PET-CT activity, fall and recovery, and the ability of NHS England to provide the PET-CT scanning service. Also, a third key finding was that the fall in activity, I suppose it might be intuitive, was less pronounced in cancer than non-cancer scans. However, within cancer scans, the decrease, interestingly, was associated with cancer type. For example, in lung and head and neck cancer scans, this group showed the largest decrease in scan activity and the slowest recovery from the pandemic. And this raises actually quite important questions around regional and social inequality, because these particular types of cancer are most associated and most prevalent in social class 5 groups of people. So overall, the findings therefore showed that the factors beyond control of NHS managers and PET-CT service providers were responsible for this large decrease in activity. Most likely factors such as clinicians bypassing or delaying PET-CT scans, or changes in the health-seeking behaviours as patients with signs of cancer delayed going to see their GP. To conclude, I think the findings are very useful and have fed through to policy decision makers, and maybe that's a bit ambitious to say that, but certainly I think the paper has contributed to informing senior managers with regard to the fact that at the peak of the COVID pandemic, there was plenty of capability to actually provide and meet the needs of people for their scanning. It was actually, as we said, the fact due to a lack of demand. So hence maybe today it's fed through to government policy to advertise the need for patients to go to the doctor if they have any sign of cancer at all. The results, of course, have been published in the academic literature and passed on at that time to the NHS Cancer Programme of Care Steering Group Committee, so as to provide NHS managers with the detailed understanding of the changes that we saw in PET-CT activity during the first wave of the pandemic. And I like to believe, certainly as I said, that the study's findings therefore have made a contribution to managers, helping managers to maintain the quality of PET-CT diagnostic services and ensuring that any delays in management plans for people with cancer are minimized, and that relapse of disease in cancer survivors is detected in a timely manner. So I think at Birkbeck, hopefully the research has made a contribution. And I should also just flag up the member we had from SWOFE that was actually published as a member of the publication and contributed. Yeah.